Welcome to TPMG Health Talk. Join us for valuable insights and practical advice on health topics that matter to you most, delivered by our top medical professionals. At Tidewater Physicians Multi-Specialty Group, we're dedicated to providing high-quality, physician-directed care to the Hampton Roads community. Subscribe now and visit mytpmg.com for more resources. Now let's dive into today's episode. On today's episode, we're excited to welcome Dr. Geoffrey Kostiner, a urologist with TPMG Williamsburg Urology. Dr. Kostiner has been practicing since 2001 and serving the local community since 2005. He moved his practice to his current location in Williamsburg Newtown area in 2012. Thank you for joining us, Dr. Kostiner.
Thank you for having me.
Well, Dr. Kostiner, urology covers a broad spectrum of health concerns, from urinary issues to prostate health, kidney stones, sexual health. What are some most common conditions you treat in your practice for both men and women?
We treat a lot of the older population in Williamsburg, and the most common disease states that we treat are kidney stones, problems urinating for men and women, and bladder cancer.
Okay, wow. You never want to hear that word.
No, the C word is not a good word.
I feel like bladder cancer is not as common, is it?
Bladder cancer is not as common, but in an elderly population, it becomes more common.
Are there some signs to watch out for?
The most common sign is blood in the urine. That's how they show up. Or people with urgency, frequency, and getting up at night, which are common signs in the elderly anyways as we age. But those symptoms, if they don't go away with common medications, then, in the back of our heads, we're thinking, are we missing something like a bladder cancer?
What are some common misconceptions that people have about these conditions? And when should someone see a urologist? Obviously, blood in the urine is must see.
The most common misconception is usually among males, is that someone will find something wrong with me. That's why people don't go to the doctor. Or they have a misconception from either what they've read on social media or usually heard from their friends, is that something dramatic or extreme will need to be done if I go to the doctor.
Well, how do you deal with patients who constantly seek, advice on social media? How do you help them sift through that noise?
That is a great question. So, first of all, most doctors don't like when people come in with a Dr. Google second opinion. And I'm sorry for using a trademark name, but that's what they call it nowadays. But I personally like when people come in with all these misconceptions, because you get to educate them on how to do research. If you look at something, you read about it, you watch a video, you talk to someone, you always have to think in the back of your head, what's the source of the information and how reliable is it? And most people just do a search, and they look at the first 5 things, and generally those are sponsored. Someone's paying for you to read them. So it's really hard. I give them reputable sources, foundations, things, sites where there's no vested interest in providing the information to sell something.
Can you explain the purpose of a prostate exam and why it's such an important part of men's health, especially as they age?
So the purpose of that is to feel for lumps and bumps, which could be a sign of prostate cancer, to measure the size of the prostate, and sometimes also to measure if it's tender, if they're having some urinary symptoms. But that's a big campaign from prostate cancer screening organizations, cancer organizations, to allow men or educate them to overcome the fear of the exam.
Wow, you deal with a lot of cancer screenings.
Correct.
You're like one of the top doctors we eventually need to see.
Like gynecologists are considered the women's doctor. Sometimes a gynecologist is a woman's primary care doctor. Like they don't have anybody else, because you go to them when you're young, sexually active for pap smears, but you don't really need a primary care doctor at that age. So for men, they consider us the men's doctor, but we can't do the primary care part.
Your background, you told me a little bit. You came into urology later.
Mm-hmm. Before I went into medicine, I studied mechanical engineering, and my plan was to do orthopedic surgery and to design new joints that are better than the ones we have now. And I did that research kind of in between engineering and medical school. And then when I got to the end of medical school, I realized I don't want to be an orthopedic surgeon, because it's just not me. And then I found urology as a very kind of high-tech and interesting field that can adjust through your lifestyle. So you can operate and see patients in the office, and then you can adjust that balance throughout your life.
Yeah, I imagine you're never bored.
Never bored, no. No, especially with urology nowadays, there's about a 50% shortage of urologists around the country.
That could be a scary thought.
And it's getting worse.
Wow.
So, yeah.
Why do you think that is?
I'm not really sure, but it's probably planning 30, 40 years ago in terms of what type of doctors we need in the country, because it takes a long time to change the ratios.
Well, technology has come a long way, which is good for your line of work. Can you talk about some of the advancements in treatments and procedures available today and how they've evolved over the years?
Absolutely. So prior to my time, the biggest advancements, I think, in urology has gone from development of very small instruments to allow you to access parts of the urinary tract without any incisions. So we are able to go inside the body without having any post-op recovery. And that's made possible by fiber optics, by digital cameras and things like that to miniaturize everything. Throughout the years, we've always gone from maximally invasive procedures to minimally invasive procedures, and then redefine the definition of minimally invasive. Because 30 years ago when I was in training, minimally invasive is now considered more invasive because we have even less invasive procedures. So if we talk about a common one, BPH, which is benign prostatic hyperplasia, which is basically difficulty urinating as you get older, as men get older. So you have the prostate, and if you think of it as an apple, and the center is cored out. And then you have the bladder on one side of the core, emptying into the apple, and then you have the urethra, which is in the penis, on the other side of the core, but the apple is always growing inwards and pushing on that core that you cored out. So all the procedures to relieve the blockage from prostate are designed at making that opening either more relaxed or physically larger. So we start with medicines, and there's been lots of advancements in medicines, and the advancements are to decrease the side effects, so they're more targeted towards the prostate. And then we go to lifestyle changes. That's before medicine, probably. Then minimally invasive surgical procedures, and now we have an abbreviation called MISP. You got to have an abbreviation if something's going to be popular.
Yeah, we love those acronyms.
Yeah, and it's not military, so it's only not 3 digits. We have to have 4 characters. So we have lots of minimally invasive procedures, lots of come and gone throughout the years, and that's the thing with new technologies. They all sound great at the beginning, and they don't all last. So there's been heating-based procedures with microwave energy in the past. There's been laser ablation procedures where they stick a needle in the prostate and damage it, and then it kind of shrinks a little bit away. Those procedures have come and gone. There's a transprostatic implant procedure. The trade name is Urolift, where it's like opening up curtains in a Broadway show. The curtains open. That's what we do. We pull the prostate aside, kind of like curtains. Then there is a steam-based procedure called Resume, where we damage a little part of the prostate in kind of very specific ways, and the body reabsorbs the damaged tissue and pulls the opening open. And then we go into more invasive procedures, which used to be minimally invasive. So everybody's heard of a TURP, transurethral resection. That's the oldest procedure, kind of minimally invasive from over 50 years ago, and it's still considered the gold standard.
Wow.
Then there's laser procedures that replace the energy used in a TURP with laser energy. Then there's a newest procedure called aquablation, which is a robotic-assisted. Now, when I say robotic-assisted, it's a procedure where the surgeon plans the treatment, and then the computer actually does the treatment with the surgeon's plan. It's actually a very good procedure. The problem with it penetrating the market is capital cost. So it's very expensive for a hospital to buy it. And that's really what I feel has been limiting its adoption.
Right. But from what I hear, it's great success.
Yes.
Amazing recovery time.
Yes. Yeah, my partners in Newport News here, we're in Williamsburg, but they have it available at Mary Immaculate Hospital.
Why are we so fortunate to have such an amazing procedure available at TPMG?
Because we have amazing doctors, duh.
Of course, of course. It's amazing that we are able to get this kind of technology and be, unique in the market.
It's true. I'm always amazed at actually how TPMG expands into different areas, and the doctors are very proactive in adopting technologies that they feel will be long-standing and really help the patients.
Yeah, it's really impressive how TPMG providers are able to adapt to new technologies and practices within their office, especially since you have the autonomy to implement changes.
That's right. Now, that's one of the big advantages of being a physician at TPMG is you have control over your destiny. You have control over your office. You have control over what procedures you're going to do. You have control over what hospitals you want privileges at and how you're going to take care of your patients.
And it probably helps in building those long-lasting relationships with your patients.
Oh, absolutely.
What are some things that you could do at home that could help with urinary problems?
Sure. Some of the basic things about how the urine is produced, so you can affect how much urine you're making by limiting factors that act as diuretics that make more fluid. Caffeine is one of them. Alcohol is another one. Chocolate, believe it or not. I know a lot of women want to hear about that. But then if you limit the chocolate at night, you may limit the red wine also.
Well, that brings us to my next question is urology can be thought of as a field primarily for men, but we know it is much broader than that. Could you walk us through the role of urology in both men and women's health?
Absolutely. So we've talked a little bit about men, so let's talk about women. So the main things that are treated by urologists for women are incontinence, so leaking with either coughing, sneezing, lifting heavy things, or with a strong urge to go to the bathroom and not being able to make it. So that's things that we highly trained on. We focus on that. Other things affect men and women fairly equally as bladder stones, any of the cancers except for prostate, testicular cancer. So bladder cancer, kidney cancer, we see men and women, young and old. You could be as young as late 30s up until whatever age. The distribution of like men and women in the urology practice is probably 50-50.
Oh, okay.
Yeah, maybe 55-45, but it's pretty close.
What advice do you have for someone who might be putting off treatment due to embarrassment or uncertainty?
When you come in and talk to someone about a personal issue, you have to understand that it's just you and them, and there's no judgment zone. It's the first step to getting help for something that may be bothering your life. And then when you go in and you see a doctor, it's a one-on-one thing. Nothing gets out of the room. Everything's confidential. If you think it's not confidential, there's federal laws that protect it. So, we're not going to say anything. And the things that we may suggest to get help with your problem, we're not forcing you to do anything. You're reading a book, except it's a verbal book and there's someone in front of you reading it to you. So we're just going to be telling you what's out there, telling you this is your problem. It's either serious or not serious. Hopefully it's not serious. And then we'll give you options on how to treat it. But it's always up to you what to do about it. So the stress about going to talk to someone should only be the embarrassment, and you should get over that in order to get help.
Well, I feel after meeting you, they'll relax because you're so easy to talk to.
Easy to talk to.
Yes, you are. Now, do you have any success stories that you can kind of share with us?
I do have a success story about a 50-year-old gentleman who spent his whole life urinating about twice an hour.
Oh. Successful
50-year-old guy, federal employee, whatever. So I ended up helping him with a procedure. It was kind of an advanced procedure after we tried a lot of other things that were more conservative. And now he's normal. Totally changed, revolutionized his life.
Wow.
From something that he just thought he had to live with for his whole life.
Yeah.
So he lived the first half of his life miserable, and the second half he's happy. just like some things you just don't know. You just don't know. Even the same for me as a doctor. I talk to other specialists about a problem I may have, because reading about things, you can't get everything reading about things. There are pearls, there's things that are in people's heads that aren't in books about experience, what works for them.
Right. As we wrap up, what's one final piece of advice you give to our listeners for maintaining optimal urological health over time?
So I always recommend when people say, what can I do better for my blank health? Usually it's prostate. And I always advise people saying your heart is more important than anything else. So and it's not a touchy-feely thing, I mean literally your heart. So if you follow a heart-healthy diet and heart-healthy lifestyle, then that will be good for the rest of your body.
Amazing. Well, thank you for joining us, Dr. Kostiner, and thank you to our audience for tuning into TPMG Health Talk. For more information or to ask any questions, visit mytpmg.com. Stay tuned for our next episode. Take care.
The information shared on today's podcast is not intended to be medical advice, nor is it meant to replace a professional consultation with a healthcare provider. The opinions expressed in this podcast do not necessarily reflect those of TPMG or its providers and physicians.